My brother Eric and I grew up with life-threatening allergies. We know what it's like to live in fear of that life or death moment. We wanted to do something different. So here at Kaleo, we set out to create an innovative epinephrine autoinjector that would meet not only our needs, but the needs of other patients, parents of allergic children, and healthcare providers. Our vision was a big one. It's the only epinephrine autoinjector with voice prompts that assists the user through the injection process, and then includes an automatic needle retraction system. And you know, all of that is in a unit the size of a credit card and a thickness of a cell phone. Kaleo knew that striving for flawless and innovative manufacturing was crucial, and we continue to advance the manufacturing process to ensure that each Auvi Q device is built with the highest standards of safety, precision, and consistent quality. It's a seamless integration of state-of-the-art technology and design, and the final assembly is happening right here in the United States.
For Auvi Q, Kaleo created a 100% fully automated robotic production line. There are over 100 quality checks throughout the entire assembly process for Auvi Q. On the production line, there are many calibrated sensors and vision systems, which ensure that the components meet rigorous standards and that each component can be placed exactly where it needs to be in the device.
Each one of our production and testing machines communicate intelligently with all units on the production line. So we know that each device can be tracked seamlessly at every stage during the production process. If there are any components that are found and identified with issues on a manufacturing line, then that component is immediately rejected and removed from the process. We perform critical device functionality tests throughout each production process, where we select and activate Auvi Qs during each run. This ensures that the production process is consistent and can be tightly controlled. Once completed, we know that this device has been through over 100 inspections and has been built with the highest quality standards before it reaches patients' hands.
Our search for continuous improvement never stops. At Kaleo, we work very closely with our manufacturing partners and suppliers to see if there are ways that we can better the process and therefore make the product better. We're never satisfied. We're continuously looking for ways that we can improve the process and therefore improve the quality of our products.
Eric and I aren't the only allergy patients in our family. In fact, our children suffer from severe allergies too, and that can be really challenging, especially during an allergic emergency where there's uncertainty and panic. You gotta feel confident, and with the drug delivery device, you want one that is safe, easy, and reliable. We are dedicated and committed to innovating and improving Auvi Q to make it a safe and reliable epinephrine autoinjector.
Indication: Auvi Q, epinephrine injection USP, is a prescription medicine used to treat life-threatening allergic reactions, including anaphylaxis, in people who are at risk for or have a history of serious allergic reactions. Important safety information: Auvi Q is for immediate self or caregiver administration and does not take the place of emergency medical care. Seek immediate medical treatment after use. Each Auvi Q contains a single dose of epinephrine. Auvi Q should only be injected into your outer thigh through clothing if necessary. If you inject a young child with Auvi Q, hold their leg firmly in place before and during the injection to prevent injuries. Do not inject into veins, buttocks, fingers, toes, hands, or feet. If you accidentally inject Auvi Q into any other part of your body, seek immediate medical treatment. Rarely, patients who use Auvi Q may develop infections at the injection site within a few days of an injection. Some of these infections can be serious. Call your healthcare provider right away if you have any of the following symptoms at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch. If you have certain medical conditions or take certain medicines, your condition may get worse, or you may have more or longer lasting side effects when you use Auvi Q. Be sure to tell your healthcare provider about all the medicines you take, especially medicines for asthma. Also tell your healthcare provider about all of your medical conditions, especially if you have asthma, a history of depression, thyroid problems, Parkinson's disease, diabetes, heart problems or high blood pressure, have any other medical conditions, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Epinephrine should be used with caution if you have a heart disease or are taking certain medicines that can cause heart-related cardiac symptoms. Common side effects include fast, irregular, or pounding heartbeat, sweating, shakiness, headache, paleness, feelings of overexcitement, nervousness or anxiety, weakness, dizziness, nausea and vomiting, or breathing problems. These side effects usually go away quickly, especially if you rest. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Please see the full prescribing information and patient information at www.auvi-q.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.